Do you know that one of the worst problems in all of typical general dentistry and prosthodontics is lack of showing the margins? Is that amazing? The big labs tell us up to 90% of the margins don't show. How in the world can we overcome that? You should be seeing margins on every one of the impressions that you make. But if 90% are bad, that means 90% of crowns are somewhat compensated. So what are we going to do about it? And then you take something like 14 units. That's the hardest thing I do in dentistry. You can include surgery, implant placement, whatever you want. That's still the hardest thing I do, and get all the margins. Got to use the right cord. You've got to use the right styptic, and we have Tim Palmer with us today, who has done some great research on that. Tell us about the difference among cords, styptics, and so forth. Where are we?
Well, cords are popular, although they're not widely used, and they probably should be used a lot more.
A lot more.
The most popular cords are currently the knitted cords. It's a soft, spongy fill of a cord. It expands nicely when it's packed down into the sulcus.
And that's the most popular product.
It is,
right there,
Ultra
Pack cord from Ultradent.
And there's others similar to it. There's Knit Pack by
Yeah.
Premier. There's Retraction Cord by Patterson. And also popular, though, are the braided cords, such as Gingibraid. And these have a little bit of a stiffer fill. They pack a little harder down there and retract just as well. So.
And then there's the one with a little wire in it.
Yeah, that's Royco Stay Put by Coltine. And it keeps its form. You can bend it to shape, and it will keep its form, which makes it a lot easier to put in some situations.
There are challenges with cords. Everybody knows. You strip the epithelial attachment occasionally. You leave a piece of cord in occasionally. We thought we may have done that even yesterday when I had a pussy, juicy exudate from a site we had just done crown preps a few days before. So there are some downsides, but the upside is, guess what? You see the margins.
Yeah. They are the gold standard.
They are literally the gold standard. Now, styptics. What about styptics? Are there differences among them by category?
There are. Aluminum chloride is one of the more popular ones. Also, epinephrine. Despite the controversy with epinephrine, it's still one of the most popular styptics. Ferrous sulfate, a little less usage. There's some implications that it stains.
And it does, under veneers particularly.
Some care needs to be taken there.
It doesn't stain the minute you put it on, ferric or ferrous sulfate. It stains subsequently. Some weeks later, the gingival portion of the veneer usually will turn gray.
And this used to not be a challenge with PFMs. But with modern aesthetic crown materials, you need to use some care.
I would say stay with aluminum chloride. Yeah. And don't cut the gingival tissues. A lot of dentists go in and just wantonly make it bleed, and then wonder how they're going to control the bleeding. If you stay supragingival until you put the cord in, then the cord pushes the gingiva down. You get that last little part of tooth structure that was not cut because the gingiva was covering it, and you don't have nearly the chance of causing a problem cutting the gingival tissues. Well, what other methods are popular and might replace cords?
Diode lasers are also very popular, especially for crown and bridge. The heat of the diode laser tip burns away the tissue, so it's simply not there to get in the way anymore.
And then you don't.
And it cauterizes as it goes. So
and
that's
then
why
you
it's
don't know where
popular.
the margin's going to end up, though.
That's the challenge with it.
What else?
You can also use a metal instrument. The Zecria gingival protector instrument holds the tissue out of the way.
Excellent. I use that almost every crown I do.
Also, really popular are clays and paste retraction materials. These don't retract as well. You have to use a compression cap with them if you're going to get the retraction. But they're very suitable for stopping minor bleeding or other liquid challenges.
And many use the paste, the really clay, as a replacement for the second cord. Because they have a high level of styptic in. You've got the first cord you still leave in during the impression, and the clay is placed coronal to that. It should be easy to wash out. The 3M brand is one of the most acceptable in our studies. It's about the right diameter and about the right viscosity and does wash out. So,
But they do not provide adequate
No,
retraction.
they
so
do not.
cords are still the gold standard.
thanks for sharing your research experience
You're
with
welcome.
us. Thanks for being with us. Join us next week.